Hello, my name is Jenn Carter, and I am a licensed clinical social worker here in the Michiana area. And I'm here today to talk to you about perinatal mental health disorders. I want you to know first, whenever we talk about a mental health disorder, this may bring up heavy feelings among people. This is a part of this discussion today where that I will review some of the perinatal mental health disorders that we see and the resources that are available to help treat them. If at all during this talk you are finding that you're having some emotions, I want you to know that you can pause. I will also include links towards resources that you may reach out to for help. This is just a brief review of some of the information that we have available and some of the resources in our community. I want to talk a little bit about parenthood, motherhood, fatherhood, and some of the feelings that many times are associated with that. Many times I call these the myths of parenthood, of a baby sleeping throughout the night with no disruption, or of nursing without any sort of issues, or a nursery room that is meticulous and clean, and this infant bonding that happens immediately. I call these myths because sometimes this is what our media shows, and many times this is not the actual truth of how we may feel. Sometimes that experience is much more like these pictures here of a baby that may have difficulty with soothing and may cry often or even be what we call colicky as well, or of feeling kind of tied to our child at times, an inability to find our own true identity or our own selves. Sometimes this even brings up some feelings of loss and grief with previous pregnancy losses or miscarriages or other losses that may happen. Our pandemic definitely had an impact on this stage of life as well too. This is much more of what many people experience, and I want you to know that there's some help that's available. There's this term that's called perinatal mental health disorder. It's a pretty big word for something that we look at during the prenatal and postpartum. So during pregnancy and after pregnancy, of any sort of emotions that may be happening during that time. We say perinatal because this encompasses both prenatal and postnatal time. But that means this is something that may happen during pregnancy or up to 1 year after delivery. Why do we say mental health disorder and not just depression? Because there are other symptoms that may be associated with this. Anxiety is a very common characteristic of perinatal mental health disorders. Some women find that they're more anxious than depressed, and some women find that they're more depressed than anxious. And this also can include other mood disorders as well. I want you to know that this is something that is very common, so common that research has shown that this can happen in 1 in 5 deliveries in women, or 1 in 10 dads may experience these. We don't exactly know why this happens. There's still research that is happening with that, but we know some things. There could be what's called a genetic predisposition. So within your genes, between your parents, there may be something that is related towards your ability to experience this as opposed to someone else. We also know the psychosocial factors of lack of support, or perfectionistic tendencies as well. In addition, we know that the things that happen during this stage, sleep disruption and poor nutrition, health challenges, communication barriers, and cultural stress can also contribute to this. We also know that there's some other risk factors. If you have a personal or family history of experiencing a perinatal mental health disorder, you may be at higher risk of experiencing that in another pregnancy or postpartum stage. We also know that someone who may have had a previous diagnosis of depression or anxiety or any other mood-related disorder may also be at higher risk. We know that changes within the hormones, so puberty or PMS, may also experience a higher risk. In addition to some what we call endocrine. So as we think of our thyroid and our hormones, that may put us at higher risk. In addition to those social factors of lack of support or financial barriers, pregnancy at a younger age, low income, single mom, or even experiencing a recent loss. As we look at this term of perinatal mental health disorders, there are some medical and therapeutic terms that may be used to describe this, such as baby blues, depression, anxiety, obsessive compulsive disorder, bipolar mood disorder, post-traumatic stress or traumatic experience, or psychosis. What I want you to know today is, again, that this is something that's common, and this is something that we have help available here in our community. Your physician or midwife or OB provider is someone that you can talk to and is a trusted person that can help with either finding medication options, or if that's not for you, therapy options or support options, or even ways to be able to approach this during your perinatal or postpartum stage. In addition, as you may have learned at the pop-up village, there's lots of resources in our area, including individualized home visits and home case management programs. There's also a local peer-based telephone support therapy that's available, in addition to some online support groups. I never want to discount the other kind of therapeutic options that are available through mindfulness and relaxation techniques, aromatherapy, nutrition, exercise, podcasts, and lots of other options that are available. Two resources I want to review is also going to be in the link. One is Postpartum Support International, or what's called PSI. They have a helpline and a text line, in addition to several support groups that are available throughout the week to be able to help people. We also have the National Maternal Health Hotline. This is a free 24-hour confidential support line that is available to moms, to dads, and to support people to be able to get them connected with resources. I want you to know that we do not have to do it all alone. We never were meant to do this. We have resources and help that's available, and I hope that you find this is enlightening to you to know that we have resources and that this is something that you do not have to go through alone. Thank you for your time.